Hello, I'm Christina Kelly, a speech-language pathologist, and this is Janet Bennett, also a speech-language pathologist. Janet, we have received numerous inquiries about lisping, the treatment for lisping, and if it can be treated. You're a specialist in this area. Can you tell us what is a lisp?
Great question. A lisp happens whenever a person sticks their tongue out between their teeth, like that, to make the S or Z sound. So it comes out as thun for sun. And the interesting thing is the TH sound, whenever you make that, you have to stick your tongue out, and so it can be quite confusing.
Yeah, and we've observed that children and adults who lisp sometimes have been mocked or have been teased by their peers.
That unfortunately can happen. And there's not a whole lot that we can do about that. I think that a lot of children maybe don't know that they have a lisp. They may know something's wrong, they may not. They just aren't always aware of it. And if a friend teases them, they still might not be aware of what it's all about. Even their family, their parents and aunts and uncles, they hear that Johnny is saying something different, but they don't know what it is or where to get help.
Don't schools offer speech therapy?
They do offer speech therapy, but the schools usually don't let the speech therapist treat a lisp because it's not an educational problem. And so I imagine this is one reason so many people get all the way through school, continue to lisp, they become an adult, and they are lispers and are either too used to it to be aware or think that maybe they're too old to get treatment.
Does a lisp interfere with the listener's ability to understand the lisper?
Usually it doesn't. That's a great question. I think that the listener probably hears something different, and they may not know what it is, but they can still understand what's being said. And this may also be one reason why adults with a lisp don't seek treatment, because it's not interfering with people understanding them.
So how do you correct a lisp?
Well, it's really quite easy. I'm glad you asked, because I certainly enjoy doing it. I think that instead of just teaching a person how to make an S or a Z sound in words, it makes more sense to make the muscles stronger in the mouth, in the tongue, in the lips. We have muscles all over, and so we make the muscles stronger by doing exercises. So I have a 7-week program. The person sees me once a week. We learn exercises. They practice the exercises. And usually the S and the Z kind of take care of themselves because the tongue learns how to live inside the mouth.
So how effective is this treatment?
It's very effective, and I'm so glad you asked, because if a person does their exercises the way I prescribe, and it won't take long each day to do exercises, then so far it's 100% effective. And you won't be a lisper anymore.
That's amazing.
Yeah. So if there are any people out there who think that they have a lisp or think that their child has a lisp, you can call me at Asheville Speech Associates. It doesn't matter what age you are, we can take care of it.